So today we're going to go over a treatment for posterior shin splints. So most of the times when patients are coming in with posterior shin splint issues, that they're feeling pain along the back side of the shin bone, about 6 to 8 inches up on the back half of the shin here. Sometimes they'll even feel pain that's coming down to the bottom of the foot, where the tendons stretch from the lower leg here all the way down into the foot itself. So shin splints usually caused by a number of muscles. Most commonly is the soleus muscle that attaches along the backside of the tibia here, and also the tibialis posterior and flexor hallucis longus, flexor digitorum longus. Those muscles have tendons that come out right on the backside of the shin here, and those can get excessive irritation, which then will pull on the fascial connections of the shin bone, resulting in pain. So typical treatment, what we'll do is we'll find where there is tenderness along the shin, and then we're going to look for tight spots in the muscle as we're going along the back of the bone here. So once we identify those areas, we're going to take the Graston tool here, and we're going to actually apply some pressure, and we're going to start digging in to those tighter spots up and down the backside of the bone here. So we like using Graston because this is going to help promote a little bit of pro-inflammation. That a lot of these shin splint cases are chronic injuries, so there's chronic irritation and low-grade inflammation in the area, and now we're using Graston to break down those tight tissues, promote a lot of blood flow, promote a little bit of pro-inflammation to help the area heal up at a higher capacity. So we're just going to run all along the muscle here. You doing okay with the pressure? Mm-hmm. And we're just going to repeat this all through those connection points of the fascia into the bone. And we're going to work it from as many different angles as we can to try to break down those tight spots in the tissue. So now let's bend the knee a little bit and let's put your foot flat on the table here. So it just puts the muscles in a slightly different position here. And then again, use the tool to get a little bit deeper into these fibers here. Always check in. Pressure okay?
Yep.
All right. Okay, so now let's straighten out the leg. So like I was saying earlier, that the tendons that come from the lower leg here, they also go down into the bottom of the foot as well. So to fully treat this, we're also going to get into the bottom of the foot. So we're working all in the arch, moving the toes through some range of motion, try to stretch out those muscles and tendons. Okay, so now with the patient flipped, I can really get into the soleus muscle and some of the bigger tender points along the muscle bellies all through the lower leg here. So again, we're going to take the Graston tool and we're going to try to just really break down the tissues, get a lot of blood flow in the area to help the area heal up again. So I'll work that all through the lower leg here. Now, shin splints can be very frustrating because they are often recurring, especially if the patient's a marathon runner, let's say, and if they get to a certain mileage point and then they start feeling their shin splints, and that gives us a clue as to some other things that might be going on causing the shin splint type of symptoms. So lots of times we have to look at running technique and what that looks like. So sometimes patients will run with what's known as a crossover gait, where they run very narrow, and you'll see that in runners when they have one foot lands and then the second foot comes through and will actually land right in front of the other foot, or even go to the other side of that stance foot. So that's something that's very common that we see. So in that case, we just have to have the patient run a little bit wider and do some drills to help facilitate that, and that will help take the strain off of this inner shin area. Work all this, get it nice and a lot of blood flow in there. And then just to finish off, just to get into some of the tighter tissues here, I'm gonna have you do some movements for me here. So go ahead and point towards the door like that. And then now bring your foot all the way up the other direction. There you go. So now again, we're working the tissues that are connecting into the backside of the bone there, causing the posterior shin splint symptoms. Trying to loosen up this whole area here. Good. Doing okay? Mm-hmm. Good. Couple more. Good. And go. Okay, so that's pretty typical treatment for what we'll do for shin splints, posterior shin splints. Do a combination of the Graston technique, and we'll do some active release to really break down those tighter spots in the muscle. And then, like I alluded to before, that we're going to then question and try to figure out when the patient's getting the symptoms the most. If there's a certain threshold with running, for example, then we can look at running technique, running efficiency, see if we can make some modifications with that, give them some drills to work on to take the strain off of the lower leg muscles and off of that bone where it's getting a lot of irritation.